Stroke. My name is Dr. Mekdes. Today I would like to talk to you about risk factors for stroke, more specifically vascular disease risk factors. You may have heard stroke being referred to as cerebrovascular accident, but we know that stroke is not an accident that happens to you, but a manifestation of problem within the body that causes vessel damage leading to stroke. These problems are known as risk factors because they're directly connected to the risk of having a stroke. Some of the risk factors are treatable and some are not. We can place these risk factors into two categories. The first one being modifiable risk factors, which are risk factors that you can do something about, or non-modifiable risk factors, which are risk factors you have no control over. Modifiable risk factors include high blood pressure, diabetes, high cholesterol, smoking, and high alcohol consumption. Non-modifiable risk factors include age, gender, race, prior transient ischemic attack or stroke, or family history of stroke. So let's go back to modifiable risk factor so we can understand them better. So when we're looking at high blood pressure under modifiable risk factor, the reason why this causes stroke is because when your blood pressure is high, it causes your blood to move faster than normal. As the blood is moving fast within the blood vessel, they're not moving optimally, which means they bump against the blood vessel, causing damage to the blood vessel. The small blood vessel within your brain, as we talked about in the prior episode, called the perforators, which branch off a large artery within the circular wheels, feel this pressure much greater than the blood vessels that are bigger in size. So these small blood vessels, to adapt to this high blood pressure, makes themselves thicker in the process called lipohyalinosis. As they become thicker and thicker and thicker, at some point they'll close off, leading to ischemic stroke. Diabetes. High sugar contact within your blood vessel is like having razor blades go through them. They cause damage to the blood vessel. Same concept with smoking, it causes blood vessel damage. High cholesterol, specifically the low density lipoprotein, like to place themselves within the arterial wall. So if you have a scenario where you have diabetes, which is causing vascular injury, and you're a smoker, which is further causing blood vessel injury, and your cholesterol is high, in that injured blood vessel, those low density lipoproteins will embed themselves, leading to plaque formation or atherosclerosis. This plaque can get big enough and cause local obstruction, leading to stroke. Or this plaque can rupture, leading to thrombus formation locally, leading to ischemic stroke. Or this plaque can rupture and a small piece can move off and distally cause obstruction in a small blood vessel, leading to stroke. Or the ruptured plaque with the thrombus on top of it. The thrombus itself could move off and cause ischemic stroke on a distal small artery within the brain. All of these modifiable risk factors, such as high blood pressure, diabetes, high cholesterol, smoking, independently increases your chance of having a stroke. When you put them all together, they really do have an additive effect and can lead to developing vascular disease, which increases your chance of having a stroke. So you can see why it's so important to control what's in the highway. If you think of the blood vessel as a highway, you should control the speed of the things that's moving by controlling your high blood pressure, and you should control the content within the blood vessel, such as controlling your blood glucose, controlling your cholesterol, and not smoking or consuming high amount of alcohol. And these can be achieved with moderate exercise and a healthy diet. And of course, quit smoking and decrease the amount of alcohol you consume on a daily basis if you do that. Let's move on to non-modifiable risk factor. We talked about age being a risk factor. This is something you cannot help. We all age, and the body goes through wear and tear process, and the blood vessel do just that as your joints do. As we age, either the blood vessel becomes weak or strong. So if you have strong blood vessel, it causes you to have increase in systemic pressure, which leads to the development of high blood pressure. And we just talked about how high blood pressure causes stroke. So as we age, we have an increased chance of developing high blood pressure, which increases our chance of having a stroke. Another non-modifiable risk factor is gender. Being a male increases your chance of having a stroke. Race is another non-modifiable risk factor. African and Hispanic individuals have higher risk of having a stroke, and this is suspected to be due to the healthcare disparity that exists in America. If you have family history of stroke, you are likely to have a stroke. If you had prior transient ischemic attack or prior stroke, your chance of having a stroke or a second stroke is higher. And a small percentage of people who have had a stroke, sometimes after a thorough examination, we do not discover the reason because they do not have the typical risk factors. Therefore, these individuals fall under a category called cryptogenic stroke because the mechanism of stroke is cryptic. We have yet to find out the reason why. There may be some type of genetic predisposition in these individuals or environmental factor that cause them to have a stroke, but the reason has yet to be discovered. Remember, stroke is preventable and it is treatable. So knowing your risk factors gives you the power to make the change that you need today for better tomorrow. Thank you for watching. I hope you found this information useful. In the next episode, we will talk about the difference between primary or comprehensive stroke centers. And always remember to dial 911 if you or someone near you suddenly can't see, can't speak, can't walk, or can't feel. Let the operator know that you or someone near you might be having a stroke so that you or the individual near you can be transported to the nearby comprehensive or primary stroke center for rapid stroke analysis and tailored treatment.